Aloha, I am Dr. Melissa Yee from Seeds of Truth. We've been allowed to have these programs for many years now, and today we're going to focus on biological dentistry. It's a very important topic that a lot of people don't really know much about, and we have had several programs in the past. But today we have a patient who can attest to the improvement that he has received through the treatment with biological dentistry. I'd like to introduce my guest to you now, Dr. Ronald Carlson and Paul Michael. Thank you both for being here.
Thank you.
It's really wonderful that you could be here today, and we have titled our program today, Near Death by Root Canal. And you will be able to tell your story and how you've greatly improved your health because of the removal of those teeth from your mouth. So let's start with Dr. Ronald Carlson. He's been on the program before and talked a little bit about the principles of biological dentistry. Maybe you could start with telling us a little bit about your history, your background, your training, how many years you've been here in Hawaii, etc.
I've been here for 50 years, and I came from the University of Michigan School of Dentistry in 1970, worked at Plumber Settlement, the Children's Clinic, and even at that time we did what they call baby root canals. But I began at that time, I thought nothing of that kind of a procedure, and about 12 years later I awoke into the biology that I had graduated with an undergraduate. So I looked at a more perspective, a more biological point of view, physiologic point of view. And so since about 1980, 81, 82, I've practiced from that awareness of the physiology and biological principles rather than what I call the regular routine procedures that are taught in dental school using mercury silver fillings, fluoridation, endodontic therapy, root canals. And nowadays, of course, that started in the 90s, the dental implants, which I feel are contrary to good principles of health.
Okay.
So that's my background, basically.
Great. Thank you very much for sharing. And Paul Michael, tell us a little bit about your background, where you were born, what brought you to Hawaii.
I'm originally from Massachusetts. I lived in Vermont skiing, Rhode Island surfing, Maine skiing. Moved to California for 10 years, so could ski and surf. And then moved to Hawaii. I've been here for 30 years and very happy to be here.
So what kind of professions have you had through your life?
Well, I started off as a licensed plumber, and that got me into being able to travel and do whatever I wanted to do pretty much. I could always fall back on plumbing. I became a waiter. Start off as busboy, waiter, head waiter. And they're wondering why I want to be a waiter if I'm a plumber. But, you know, you could travel and do whatever you want to do. Became a bartender, massage therapist, pipefitter, certified welder. And when I came to Hawaii, I came here as a welder. And when they found out that I was a plumber, they said, "Why aren't you plumbing?" And I said, "I don't like plumbing." And it worked out really well for me. I stayed with the same company for 20 years and just went up the ladder to become superintendent of the company.
Okay, but you've also worked in a power plant.
I worked in nuclear power plants in California, San Onofre, and picked up some radiation there, and worked at Diablo Canyon. But Diablo Canyon was still in the process of being retrofitted. Bechtel took over, and Ronald Reagan was president, and all of his main men were with Bechtel. So needless to say, that plant is online, rolling along. But, you know, it's, I mean, for me, when I asked them how long do these plants last, when they told me 30 years, I was in shock.
So how has your health been affected by all these different professions you've had?
That's a pretty good question. I worked at a paper mill in Maine, and I mean, it was pretty bad there. I worked in a lime room where they gave everybody boots. And I was saying, why are they giving us boots? And they said, oh, because it's eating the shoelaces out of your shoes. Mm-hmm. So I said, so what's it doing to us? And you know, that you never realize what a paper mill is, how much pollution until you work at one. I mean, chlorine gas tankers would come in. They said if the alarms go off, hold your breath and run out. What? So happily, I wasn't there too long.
Yeah, good.
But I worked in refineries in California also, and you know, one time I'm welding under a pipe, and the guy's spraying a hose all around me and getting me kind of wet. And I'm asking him, you know, you're getting me wet. And he goes, well, all the lines around you are alive. I thought, what? So it was like interesting work.
Yeah. Well, here you are in Hawaii, and you have had the fortune to meet Dr. Carlson along the way. I'd just like to ask Dr. Carlson, give us a little bit better idea of what biological dentistry entails.
Well, as I said earlier, the main window that we look for if you term yourself a biological dentist is something that was true about 100 years ago, using physiology as a window, or biology. What is the normal process in life of keeping your health? It's not particularly lime or chlorine gas or these various things that we have in our modern society. It's really trying to minimize the intake of, let's say, non-biological materials. That includes alcohol, drugs, foods that are highly suspect in terms of their purity, and the amount of toxins from the pesticides. Heptachlor, way back in the 70s in Hawaii, was a big issue with the cows, milk. And the idea is to really look and focus at the principles of first doing no injury to a person, and then doing the best that you can biologically. Mm-hmm. And we as dental surgeons are usually trained well in biological sciences, biology, chemistry, physiology, anatomy, at least I hope we are, and that we can apply those rather than the general idea of this is okay because it's not killing people. For example, mercury was instituted in the United States in the 1820s. And people at that time, the dental profession, wasn't a bunch of us, they pushed it away. They said, no, mercury is a known neurotoxic substance. We will not have it in our filling materials. But as time went on, it became very common to use a substandard material called amalgam fillings. And so now you have it going to the point where in the mid-50s, in this century, the 20th century, it becomes a prime filling material. Now it's kind of gone out of popularity because we have new materials that are actually far superior. So biological dentistry is using biological principles to work with people to their good benefit and health.
What was it that made you wake up to the choice that you've made now to follow this type of work? Were there any specific patients that you met, or any kind of situations where you felt, I can't continue to work in this way?
No, I knew intuitively there was some relationship between what I was doing in the oral cavity and the toes and the rest of the body. I didn't know the connections there. So I would say it's really the advent of certain books that I read in the mid-70s, late 70s on acupuncture. I think it's coming to Hawaii too, because you have an integration of East and West here. Mm-hmm. And you have more accessibility to the ideas and theories of ancient Chinese medicine, Ayurvedic medicine from India. So I think there were a number of issues. One very key point was 1981, when I met Voll, who's from Germany, who did electroacupuncture according to Voll. I had not known about acupuncture other than looking at some charts and saying, that's interesting.
Mm-hmm.
I don't know. I can't make a judgment whether or not it's so or not. But after I met Voll and studied some other disciplines, I became convinced that there's more to this issue in relationship to the oral health and the systemic health. But that's not what my training was in dental school.
Right.
Very myopic. That's the only area we look to. Once in a while we'll look beyond that, but very rarely.
Yeah. Maybe we can have a look at the chart about the stomach meridians. So a lot of times when you go down to Chinatown, you see these kind of pictures posted up on the walls of the acupuncturist's office. And it's very interesting for people, but they don't really understand what it means. But here specifically, we see the pathway of the stomach meridian, starting from the face, coming down through the pupil, going back up to the forehead, down through the neck, along the chest, down through the abdomen, and down into the legs, into the toes. So for most people, it doesn't mean anything, but for acupuncturists, all these orange dots we see here are actually areas where we would insert needles or do stimulation. And because the stomach meridian runs through the face, it does affect and be affected by what is going on in the jaw. Mm-hmm. Would you agree, Dr. Carlson?
Yes, not only agree, it's true. Those orange little dots represent energy nodes, but the entire line that you see is an energy channel. This is invisible. It's not something anatomically known in our surgeries or in our training, but this is the next layer beyond the physical. So it's a concept that is either accepted or rejected by the doctor, but I have firsthand experience of the relationship of many of these disabilities in the mouth that affect the stomach,
right,
and other parts of the neurological or the acupuncture meridian.
Right, and so Dr. Reinhold Voll, being an acupuncturist as well as a
MD,
and a ham radio operator, knew very much about the application of electricity and how the lack of movement or chi through the meridian can cause pain and can be alleviated by the stimulation of the meridian.
Yes, you use the word chi, which means voltage or current. Mm-hmm. And the whole body is an electromagnetic field.
Right.
Everything operates on electricity within the body. And even when you were talking about plumbing, that water flow creates an electrical charge.
Right.
And so we have to look at things through that kind of a window rather than just what we are trained with in school. And you see these blockages, these little nodes. Sometimes you'll have a foci of infection or a focal local breakdown of tissue that will block the energy flow through that meridian. A dental organ, like when you saw that meridian running down through the stomach, if you have a focated tooth, a filling, a dead tooth, a root canal tooth, or a dental implant, it will block the energy flow down that meridian in the completion because it's a circle. It
Right.
comes like this, the yin and yang.
So let's get back to Paul.
Yes.
Now you had some very severe symptoms and they gradually got worse. So maybe you can tell us a little bit about how you started to feel and what eventually led you to meet Dr. Carlson and help to change your situation.
Well, the first thing that happened to me was we cleaned the beach, my wife and I, and a country crew group of guys I'm with on the North Shore. And that evening, I got a rash on my chest and on my neck. So I'm thinking, okay, do I want to go to urgent care or what? Mm-hmm. I end up going to urgent care. They said, what did you do? I told them what we did, clean the beach. They said, okay, you either came in contact with something, or something you ate, mm-hmm. or something you're allergic to. Mm-hmm. Gives me a shot of something and then prednisone. And that probably went away in maybe 1 week's time. Then everything came back again, only worse. Now the rash is on my palms of my hands and my arms, my legs. I went to my own doctor. He's going like, I never saw a rash on somebody's palms. And it was like blood looking.
Mm-hmm.
And so he sends me up for allergy testing and different blood tests. It comes back where, okay, you're allergic to this grass, you got rugs in your house, yeah, you probably got dust mites, but nothing is very high. Everything is like 2 or 3, nothing like off the Richter scale.
Mm-hmm.
And it ends up that I go and see a allergist or dermatologist first, and I'm ready to go on a trip, and I'm ready to cancel the trip, and now the rash comes back again because my doctor puts me on prednisone again, and so it eventually goes away. Then it came back, and I told him I'm ready to cancel the trip, and he said, I'll give you a shot, you'll be all good for the trip.
Mm-hmm.
So he gives me a shot and more prednisone, and I go on a trip, and I'm fine. I come back, and maybe 3-4 days later, the rash is coming back.
Mm-hmm.
He gives me another shot and tells me I've had like 3 months worth of steroids in the last 3 weeks.
Mm-hmm.
And I'm thinking like, well, that don't sound good.
Mm-hmm.
So then I end up going to an allergist, and she's doing a bunch of different blood tests on me, and ends up that I'm pretty good. I'm not too bad, and then all of a sudden, everything comes back again.
Mm-hmm.
And we're supposed to go on a cruise, and my whole face and lips are all swollen. I have rash all over my body, and she sends me to a cancer doctor. And my wife is with me, and she goes, what are we doing here? I go, I don't know. This is where she sent me. And we go in there, and he looks at my blood tests and says, I could give you a spinal tap, but I don't think you have cancer, but there's a 10% chance you do. I said, I don't want a spinal tap.
Mm-hmm.
And then he said, okay, let me send you to this other doctor, and he'll take biopsies of my rash. And that's what I ended up doing. He takes the biopsies and sends them out. The results come back, and he's just like shaking his head, thinking like, you know, it shows this, but you don't have this. It's showing this, but you don't have that. So there, he said, I'll send all these results back to all of my other doctors. And I'm thinking like, well, what do they know? And I just kind of was a little frustrated and fed up with the doctors. And I ended up going to play in a golf tournament. And after that, I was completely drained after that tournament. And I came home, and I was laying in bed, tired, no energy, don't want to eat. And in the meantime, I would surf and always had plenty of energy. And it ends up that I'm just like in la-la land. And my wife goes to work and ends up thinking something's wrong with me, comes home, and I'm like incoherent.
Mm-hmm.
And she calls 911. They rush me to the hospital, and my blood platelet count was down to 7. And that's supposed to be between 150 and 450.
Yeah.
And they tell my wife, if you were any later, things would be a lot different. And she left really early from work. So if she never came home, I wouldn't be here today.
Mm-hmm.
And, you know, they called it TTP, a rare blood disease. But, I mean, I think it was mainly because my platelet count was so low.
Yeah.
Because they had to call it something.
Right.
And then after that, I had 75 platelet transfusions.
Wow.
So I was in the hospital for 5 days, and I had 15 transfusions every day. And there's only 2 machines on the island, and they're at Capulani for children. And usually it's a disease that's hereditary that children get. And they couldn't figure out why I have it. And it ended up that when I left the hospital, they thought, should we leave the tubes in him because they think I'm going to need more transfusions. And I'm thinking, like, I don't want this tube sticking out of my neck. And so they took everything out, and I was good for about 3 or 4 months. And then I could tell my immune system went down. And now all the rash and everything comes back. And a friend of mine was telling me, do you have root canals? And I'm thinking, like, I don't know. And when I got out of the hospital, one of my teeth started bothering me. And when I went to my dentist, he goes, yeah, you're going to have a root canal. And I didn't want the root canal. And it ended up that I had the root canal, and the next day, my whole side of my mouth was infected. They put me on antibiotics for 10 days. And in that whole time period, which was probably over a year, I would get the rash, and every time I would get it, it would be worse. And then I think finally someone gave me Dr. Carlson's number. And I thought, okay, let me call him and have him take x-rays. And when he took the x-rays and told me I had 4 root canals, I was like in shock. I'm pretty much going like, what? I never knew I had that many.
Yeah.
And it ended up that he took out the first one that they did. And that one was pretty bad. And then he took out another one. In the meantime, I'm seeing an autoimmune doctor and he's a rheumatologist. And I'm saying, like, before that, you think it could be root canal.
You said that to your doctor.
I said that to my doctor. The doctor goes, Paul, you know how many root canals people have every day?
Right.
And I said, do you have any patients like me?
Yeah.
And he said, no. And I said, that's why I have to look outside the box.
Yes, good for you.
And he put me on this methotrexate and the prednisone, and it just made me worse. And I ended up telling him, I'm not taking this anymore.
Good for you. You were strong enough to say that you didn't want it.
And then he said, there's another drug I can give you. It's when your body rejects a transplant. And I haven't had a transplant, so why do I want to take that?
Right.
And, you know, and it's like they're clueless of what was going on with me.
Yeah, so at this point,
I had seen Dr. Carlson. I had 2 root canals out, and I had gone back to the doctor, and he did blood tests, and he goes like, wow, you look good.
wow.
And I told him, I go, well, it might be a placebo effect, but I've had 2 root canals out. And he looks at me and doesn't say a word.
Yeah.
And then I ended up getting a small relapse because of a stress-related thing that I knew it brought on. And then that kind of went away. And I said, okay, let me have the 3rd root canal taken out. And then after that, I said, okay, I only got 1 more in my mouth. Do I want to have that taken out or not? And you know, I'm feeling pretty good. But then I ate a lot of crab, and all my lymph nodes got swollen on my neck.
Yeah.
And the doctors are all thinking relapse.
Yeah.
They put me on like 70 milligrams of prednisone, and everything goes away in 2 days. And they're pretty much thinking, what happened? And it ends up after that, okay, let me wean off this prednisone as fast as possible and have the last root canal taken out. And I feel a lot better.
Good. Well,
And I'm happy that I met Dr. Carlson.
Absolutely.
And him showing me my x-rays, and I even went back to my own dentist and he took x-rays. I think this might have been all around the same time. And I'm thinking of possibly going, I don't know if I had met Dr. Carlson yet. I think I might have, but he's sending, there's another doctor in Texas that was going to do implants, and they take all your root canals out one time. And I'm thinking, I'm going to have to fly there. I'm going to have to all this done. Then you got to be, after 3 months, you got to come back and all this stuff. And I was happy to have Dr. Carlson do the Carlson Bridge on all my root canals, and I'm a lot happier now.
And here you are now.
And
You're alive.
I'm alive. My health is, after my root canals came out, I got back into building all my muscle up, surfing back again on the North Shore, surfing high surf advisories until about 2 months ago.
Okay, so let's ask Dr. Carlson, you know, when Paul came to you, what situation were you observing?
Well, I knew he had an autoimmune response to something, and he had a low platelet count, which is blood poisoning to me, related to, could be, the abscesses or the condition of the root canal dead teeth. Could also be related to a lot of other things, but overlooked in our profession or generally in healthcare is this issue with root canal therapy. It's like your one doctor said, Paul, do you realize how many root canals are done every year, every day in the United States? What does that have to do with anything about the health?
Right.
You know, 7,000 people end up in the emergency room because of abscessed root canals, failures every year. This is a shocking statistic. So when Mr. Michael came in, I recognized there was something that I'd seen somewhat before in other people, but not so specific as his. And we began to look at, he asked me, where are the root canals? Which ones, doc, should I do first? And my theory is you don't do it all at one time. You don't do scorched earth. You literally pace it. And that's what we did. We approached it that way with Mr. Michael.
Okay, well, this is building up to be quite an interesting adventure and thriller. So I think we'll return in part 2, and thank you both for being here. We're going to learn a lot in this program. Thank you very much.
Thank you.
Thank you. You're very welcome.